If you're looking to shake up your strengthening routine, follow along in this video as I guide you through 5 different upper body strengthening exercises on a foam roller. These are going to help you improve your upper body strength while working on your core stability. These exercises are especially great for breast cancer survivors who are recovering from surgery to get stronger. I'm Dr. Alex Hill, a board-certified oncology physical therapist and lymphedema therapist. Make sure that you subscribe to my channel below for more videos on cancer survivorship and exercises. Many people associate foam rolling with improving mobility and working on your muscle tightness, but using a foam roller like this one with strengthening can be helpful because it can work on your core and balance as you're doing your strengthening exercises. For the exercises in this video, you'll need a set of light weights like 2 to 5 pounds, a light resistance band, and the foam roller. If you need a foam roller or resistance bands or weights, I do have a link in the description below to my Amazon storefront to get your gear. With these exercises, you want to start out with a light resistance band and light weights. You should have full and normal or nearly normal range of motion with your shoulders before you start these strengthening exercises. Check out last week's video for mobility program to get your range of motion back first before you really get going with these strengthening exercises. And as always, before you start any exercise program, check with your medical provider first and make sure that if you have had radiation therapy or a surgery for your cancer treatment, that all of your incisions are healed and you have no open wound areas on your skin. You should not have any pain when you do these strengthening exercises. If you do have pain, shortness of breath, or any other unusual symptoms, stop doing these exercises. Additionally, if you have lymphedema in your arm, make sure that you're wearing your compression sleeve. With these exercises, I'll show you a couple repetitions of each exercise so you know how to perform it correctly. But when you do these exercises as part of your weekly exercise routine, you should do 2 to 3 sets of 10 to 12 exercises. After about 2 to 3 weeks of doing these exercises regularly and they start to get easier, then you can progress to the next higher weight or more resistance. All right, for all of these exercises, you're going to be lying lengthwise on the foam roller with your sacrum, your spine, and your head all supported by the foam roller. Your feet are going to be flat on the floor, a little bit wider than hip width apart to help support you. We're going to start with the first couple exercises with our hand weights. So for the first exercise, we're going to be working on our shoulder blade muscles. And so you're going to grab your weights, you're going to hold them directly over your shoulders and your elbows stay straight the whole time that you're doing this exercise. What you'll do is you'll punch up towards the ceiling and then let your shoulder blades come back down. Punch up and let your shoulder blades come back down. So you're not moving your elbows with this, you're keeping them straight the whole time. Punch up towards the ceiling, really reach for the ceiling as much as you can, and then control them back down. Punch up and come back down. Punch up and come back down. After a couple reps of this, you might feel the shoulder blade muscles start to burn a little bit. That's a good thing. That means that they're starting to work, they're starting to kick on. And again, you're punching up, elbows stay straight, and you're bringing your shoulder blades down. So as you do that exercise, you should feel your shoulder blades moving along your ribs as you punch up and come back down. If it feels hard to control with the weight, just start with no weight and just punch up just towards the ceiling to get the movement down. The next exercise is a chest press, so you'll grab your weights. You're going to start with your arms in kind of a field goal post position. So you're going to be at 90 degrees at your shoulder, 90 degrees at your elbow, and then you're going to push upward and then elbows come back down. So you should stay in line with your chest as you do this. So you're going to push the weights up and control them back down, push up and come back down. You want to engage your core as you're doing these movements to make sure that you stay stable. And again, this is working your pec muscles, so you're pushing up, elbows come out to the side, push up, out to the side. So you should start to feel your pec muscles start to burn a little bit. That means, again, they're kicking in. Nice, slow, controlled movements as you do this. The next exercise, you just need one of your weights. So you're going to start with your arms up overhead, and you're going to keep your elbows straight the whole time with this exercise. You're going to slowly bring the weight back overhead until you feel a little bit of a stretch in the underarm, and you really have to engage to not let your back arch up. So you're coming back and then slowly bringing it up overhead to at your shoulders. So you're going to slowly bring it back and bring it forward. So this is working your lats. This is working your triceps a little bit. So we're working on those back muscles to get those stronger after your surgery or your radiation. Again, elbows stay straight. Everything is slow and controlled. You may need to start in a smaller range so that you don't get that back arch. That's okay. Just slowly, as you get stronger, start to come back farther and bring it back up. Again, you can do this one starting in sets of 10 to 12 and progressively work your way up from there. The next exercise, you're still keeping that one hand weight. This time we're working on your triceps. So these are called skull crushers. So you're starting with your weight above your shoulders. You're dropping the weight by bending your elbows towards your skull, hence the name skull crusher. And then you're pushing the weight away from you up towards the ceiling. So you're bringing the weight down to your forehead, push it away. So this one you'll definitely feel in the back of your arms at your triceps. We want, again, slow, controlled movements, pushing it up and bringing it towards your forehead. As you do this exercise, again, make sure you're engaging your core so that you're keeping your balance on your foam roller and get those triceps burning. All right, the last exercise, you're gonna grab your resistance band. You're going to hold it about shoulder width apart. You're holding it up overhead, directly over your shoulders, and you're going to be moving one arm at a time. So with this first one, I'm gonna keep my left one still, and I'm going to bring my right arm out to the side and then back up. So it's staying in line with my shoulder. Then I'm going to keep my right one still, and I'm going to drop my left one and then come back up. So you're alternating arms as you do this exercise. Everything should be slow and controlled. And with this exercise, you're working on your back muscles, your shoulder muscles. You're working your core to keep you balanced as you're doing one arm at a time. And again, you want to keep that other arm stable. You're not bringing it along with you. You're keeping it directly over that shoulder. With this exercise, again, 10 to 12 times on each side. And again, working those shoulders, working your back, and working your core to keep you balanced. Great job with those strengthening exercises. Remember to take it slow, listen to your body as you do these exercises. If you found this video helpful, please give it a thumbs up, share it with anybody who might find it beneficial, and subscribe to my channel for more tips on cancer rehab and survivorship.